We are going to read Lyme disease guidelines from the Green Book UK guideline. Lyme disease is very important and comes up in the exams with a radio station or a clinical case or in form of facial palsy, for example. So it's very important to know everything about it. Okay, recognition and assessment. First, you have to start with the history. Ticks mainly found in grassy and wooded areas, including urban gardens and parks. Bites may not always be noticed, particularly high-risk areas south of England and Scottish highlands, but infection can occur in many areas. Lyme disease may be more prevalent in parts of Central, Eastern, Northern Europe, including Scandinavian and parts of Asia, United States, and Canada. Most tick bites do not transmit Lyme disease. Prompt correct removal of the tick reduces risk of transmission. Do not diagnose Lyme disease in individuals without symptoms, even if they have had a tick bite. Symptoms and signs. Rash. We have two types of rashes in here. See figure 1 images of rash. Okay, we'll have a look on that later. So we have two types of rashes in here, erythema migrans and the rash due to reaction due to the tick bite. Erythema migrans, it's going to be erythematous, increase in size, and may have a central clearing. Okay, not usually itchy, hot, or painful. Usually becomes visible from 1 to 4 weeks, but can appear from 3 days up to 3 months after a tick bite and lasts for several weeks, usually at site of a tick bite. So that's the erythema migrans description. It's going to be erythematous, increasing in size, have a central clearing, not usually itchy, hot, or painful, usually becomes visible from 1 to 4 weeks, can appear from 3 days up to 3 months after a tick bite and lasts for several weeks, usually at site of tick bite. The other kind of rash is a reaction to tick bite, usually develops and recedes within 48 hours from time of tick bite, more likely than erythema migrans to be hot, itchy, or painful. So that's the difference. That's the differences. So in here we have the reaction to tick bite is going to be around the place, around the location of the bite. It's going to be hot, itchy, painful, may be caused by inflammatory reaction or infection with a common skin pathogen. So we don't have only one type of rash. Let's keep that in your mind. We have two types of rashes, erythema migrans and reaction to tick bite. Okay, organ system. So in Lyme disease, there's many systems being affected. So let's have a look on them one by one. Consider possibility of Lyme disease in children presenting with symptoms and signs relating to one or more organ system. The main systemic affection is going to be neurological, the central nervous system. So this is going to be in form of facial palsy or other unexplained cranial nerve palsies, meningitis, mononeuritis multiplex, encephalitis, neuropsychiatric presentation. But the most common neurological presentation is facial so far. So facial palsy or other unexplained cranial nerve palsies, meningitis, it could be mononeuritis multiplex, it could be encephalitis, neuropsychiatric presentation, inflammatory arthritis affecting one joint or more, may be fluctuating and migratory. affecting one joint or more, maybe fluctuating and migratory, cardiac problems, heart block, or pericarditis. So on Lyme disease, there is a heart problem. It could be heart block or pericarditis, eye symptoms, uveitis, keratitis, skin rashes, acrodermatitis chronica atropicans, acrodermatitis chronica atropicans, and lymphocytoma. Lymphocytoma. Again, the organ system is very important. Neurological, inflammatory arthritis, cardiac problem, eye symptoms, and skin rashes, in form of acrodermatitis chronica atropicans and lymphocytoma. It's a bit weird names. It's very rare kind of rashes, but you have to know about it. Acrodermatitis chronica atropicans and lymphocytoma. Okay, other symptoms, fever and sweats, swollen glands, malaise, fatigue, migratory joint or muscle aches and pain, cognitive impairment, for example, memory problems and difficulty in concentrating, sometimes described as brain fog, headache and paresthesia. Okay, and as well as neck pain or stiffness. Investigations, what we're going to do in this situation. If high clinical suspicion of Lyme disease and erythema migrans, diagnose and treat. No laboratory testing required. If erythema migrans not present, so it's merely clinical diagnosis and clinical suspicion. If you were quite sure clinically, so you have to go straight ahead to the treatment. If erythema migrans not present, if less than 4 weeks duration from symptoms onset and high clinical suspicion, start treatment. If 4 weeks or more from symptom onset, offer enzyme-linked immunosorbent assay, which is ELISA test. And this need to check the NICE guidelines on the website itself for that. Negative results doesn't rule out Lyme disease if high clinical suspicion. If negative, more than 12 weeks from symptoms onset, often immunoplot test. If ELISA positive, offer immunoplot test. If immunoplot positive, offer antibiotic. If immunoplot negative, consider alternative diagnosis or refer to pediatric infectious disease specialist. So again, we'll go through investigations again. If you have a high clinical suspicion of Lyme disease and you are pretty sure, and we have erythema migrans very clear for you, so that's you have to diagnose immediately and treat immediately, no lab tests required. If erythema migrans not present and you have the a duration of the symptoms less than 4 weeks, and you have high clinical suspicion, you treat immediately. If the symptoms duration is 4 weeks or more, you have to offer enzyme-linked immunosorbent assay, ELISA test. Negative results of ELISA do not rule out the Lyme disease diagnosis if you have a high clinical suspicion. If ELISA negative and the duration of symptoms more than 12 weeks from symptoms onset, so we have to do immunoplot test. If ELISA positive, offer immunoplot test as well. If immunoplot positive, offer antibiotic. If immunoplot negative, consider alternative diagnosis or refer to pediatric infectious disease specialist. So it seems that immunoplot test is very important and crucial here to rule out or to confirm diagnosis if you don't have any clinical symptoms, or if you have ELISA negative for more than 12 weeks, or if you have ELISA positive as well, you have to do an immunoblood test on top to confirm. If immunoblood test is positive, so you have to go straight away to the antibiotic. If immunoblood negative, so that's not Lyme disease, you have to think about another diagnosis and you consult your pediatric infectious disease specialist. Management. Erythema migrans, non-focal symptoms affecting cranial nerves or peripheral nervous system. Okay, so on the management, it depends on the presentation. If the child has or the patient has erythema migrans, he doesn't has any non-focal symptoms affecting the nerves or peripheral nerves, and his age 9 years or more, he will take doxycycline for 21 days, less than 9 years amoxicillin for 21 days. So it's according to the age group. Lyme disease affecting CNS, ceftriaxone, when symptoms resolve, if aged more than 9, switch to doxycycline. Total treatment 21 days. So if there is no central nervous system affection, so more than 9 years, doxycycline, less than 9 years of age, amoxicillin. If there's CNS involvement, that's ceftriaxone for 21 days. Lyme disease, arthritis, or acrodermatitis chronica atropicans, the same, but the duration will be longer for 28 days. If more than 9 years of age, doxycycline 28 days, less than 9 years, amoxicillin for 28 days. It's gonna be more longer in here in cases of arthritis and acrodermatitis chronica atropicans. Lyme carditis, hemodynamically stable, aged 9 years or more. He will get doxycycline for 21 days, hemodynamically unstable and or aged less than 9 years. He will take ceftriaxone for 21 days. So this is Lyme carditis again, if he is stable or unstable. If he is hemodynamically stable and his age 9 years or more, he will take doxycycline for 21 days. Hemodynamically unstable and his age less than 9 years, he will take ceftriaxone for 21 days. Okay, we have a couple of pictures in here for Lyme disease, the images of rashes that we have. The image 1, it's a small erythema migrans lesion on arm with a central clearing and bull's eye, as we can see in here. Image 2 is a large erythema migrans lesion on leg with a central clearing and bull's eye as well. This lesion is a bit larger than this lesion. Image 3, large erythema migrans lesion on a leg and faint bull eye as well. This is erythema migrans is very clear with bull's eye. This is under the arm. There's no central clearing in here. Image 5, this is erythema migrans as well without bull's eye. Okay. Multiple erythema migrans lesion on the back. So we don't have only one single lesion in here. There's 1, 2, 3, 4, 5. I can see 5. This is the big patch down here. This is 5 erythema migrans in one patient on his back. Image 7. This is very, very clear with the bull's eye and central clearing. And another one without bull's eye, just a circle. This is a large one in here in an infant or toddler. This is the shoulder and chest without central clearing. This one on the back with central clearing and bullseye. So we have finished the Lyme disease guidelines. I wish you like it and you enjoyed it, and I wish the best for you in your upcoming exams. Thank you for watching.